On November the 1st, 2018, CAH Area Health hosted the workplace support launch for the Strengthening Health Service Response to Family Violence initiative. Jenny Salkeld, the Director of Nursing and Clinical Care, was the MC for the event.
So welcome, and thank you very much for coming.
Jeff Isles, CEO of CAH Area Health, also presented on the organisation's commitment to reduce family violence. The launch featured survivor advocate Christine Craik, who shared her insights. Christine has been a social worker for over 30 years and has worked in a variety of roles from housing through to trauma debriefing. The Strengthening Health Service Response to Family Violence initiative is a whole of health service approach which aligns with the Family Violence Protection Act 2008. The Act defines family violence as including a range of behaviours such as physical and sexual abuse, emotional or psychological abuse, economic abuse, or behaviour that is threatening, coercive, or in any way controls or dominates that person or causes them to feel fear. The definition also refers to any behaviours that cause a child to witness or hear or otherwise be exposed to the effects of family violence. Christine's message was incredibly powerful and moving. Sadly, this is an issue that can be close to many of us, and Christine did a wonderful job really explaining some of the complexities around this issue.
Most of the women didn't know they were living with abuse or that the abuse was connected to their health issues. So the two that did disclose to health professionals were silenced by the responses of those health professionals. One told us she wasn't thinking of her children and she had to leave and threatened child protection intervention. So women reported that health professionals validated the perpetrator's voice, they validated those community myths, and they only treated the presenting symptoms. Most of them came away with mental health labels or prescriptions for drugs that left them quite groggy and unable to think clearly, which just exacerbated their situation.
Health services understand that family violence is a serious issue which affects some members of staff as well as our volunteers. The early phase of this initiative focuses on promoting a workplace environment where staff and volunteers feel safe and supported if they choose to disclose their experiences of family violence. The launch today complements a lot of fantastic work that has happened in the family violence space within this organisation. As we move forward, it's about continuing to build capacity for us to identify and respond to family violence. That organisational support doesn't just apply to our patients and consumers. It's really important we apply that to our staff as well as our volunteers. The message today is that CAH Area Health is here to help.